Hey, thanks for coming back for part 2. We are going to talk about Streptococcus pyogenes. So Streptococcus, we're talking about gram-positive round bacteria that when they divide in one plane, and so they form chains. So that's what strepto means. Pyogenes, pyo means pus, so these are also pus-forming infections of the skin. And so we already talked about those hair follicle infections, abscesses. We talked about impetigo and wound infections when we discussed Staphylococcus aureus. We're going to throw in necrotizing fasciitis on this one. And then Streptococcus also causes these other diseases when they are located in particular body regions and make certain toxins. So the Streptococcus genre, they are going to be classified based on the type of hemolysis. So we've used blood agar plates in lab, or we've discussed them. And when you culture bacteria on blood agar, because remember Streptococcus, they're also fastidious. They also like a lot of carbon dioxide and a little bit less oxygen. But some of them are capable of totally lysing the red blood cells, and so that's called the beta hemolysis. And so Streptococcus pyogenes is one of those. They are beta hemolytic Streptococcus. There's also Streptococcus agalactiae, which we're not going to talk about too much, but that is a resident commensal. Where this one comes into play is that when a woman, if she's a carrier in her vaginal canal, when the baby is born, Streptococcus agalactiae can cause neonatal pneumonia and neonatal meningitis. And so that's just another one that's beta hemolytic. Sometimes though, Streptococcus, they don't lyse it completely, so what you get is sort of this greenish halo around the bacterial growth. And so that's called alpha hemolysis, so partial hemolysis, and we're going to talk about Streptococcus pneumoniae. There's another species, Streptococcus viridans, and that actually got its name because of that greenish halo that they make on a blood agar plate. And this is also just a commensal that can also cause that neonatal pneumonia or neonatal meningitis. And then you have some that are gamma hemolytic, but they're not Streptococcus, so Enterococcus faecalis. We may work with those in lab. So they can be classified based on hemolysis on a blood agar plate, and then also through what's called Lancefield antigens. So on the surface of the cell wall of these Streptococcus, they have different antigens. And so there was a woman, Rebecca Lancefield, she did her work in the 1900s. She used different antigens, and she realized that you could separate out the different streptococci based on their surface sugars. And so the big one, Streptococcus pyogenes, is a beta hemolytic, so total hemolysis, and then they are in group A. And so she gave all her groups A, B, there's C, D, E, and so on. But A, B, and D, those are the big pathogenic groups. And just you may hear refer to Streptococcus pyogenes, beta hemolytic group A. So Streptococcus pyogenes, a lot of people carry this in their throat, or in their nasopharynx, so back here, this upper part of the nasal cavity. So whenever someone coughs or sneezes, it can be transferred from person to person. And so here you're looking at someone who is a lovely case of strep throat, and you can see the redness. And so once again, think of those hemolysins that are lysing those red blood cells. So signs of pharyngitis, so inflammation of the throat. So strep throat, yeah, they cause that. So fever, the throat is going to be red. You see patches, and often you're going to see pus, particularly in those tonsillar crypts, and you just saw those tiny little hemorrhages. Most patients will recover about a week, but you really want to treat this with antibiotics because we're going to talk about something called post-streptococcal sequelae. So if it's not treated and someone doesn't take their penicillin, their antibiotics, a full round, then they can suffer from problems after that infection. Most sore throats are caused by viruses, but Streptococcus pyogenes causes about 20 to 30% cases of sore throat. They can be tested for in a doctor's office, so they do that rapid strep test, or it's called a rapid antigen detection test, so using serology. Then two, they would also then plate it, send it to a lab for further confirmation. But unlike Staphylococcus, Streptococcus is, most of them are penicillin sensitive, so penicillin can be used. Some strains make a exotoxin. It's called a pyrogenic exotoxin, so that means fire. So it starts off as strep throat, but this particular strain, not all of them, has been infected by a phage. So this is an example of transduction and that horizontal transfer of genetic material that gives them the ability to make a special toxin. So this toxin goes systemic, and then it causes a rash, and so that's why it's called scarlet fever. So this was more of a problem in the 1900s. It was really a big issue. They would have epidemics, and it could be 95% fatal, particularly before the advent of antibiotic therapy. So it's really disappeared, but there has been some cases in the UK and cropping up in Asia again. But that's scarlet fever. So it's just an extra toxin on top of strep throat infection. So what often occurs with Streptococcus pyogenes, so strep infections, is something called post, so it's after a streptococcal infection, sequelae, so complications. And these are due to an autoimmune response. Streptococcus pyogenes has a high hyaluronic acid capsule, which looks a lot like our connective tissue. So antibodies that are made against that initial infection then have cross-reaction with our tissues. So it's an autoimmune response. Usually it's going to occur 1 to 3 weeks after a streptococcal infection, so after strep throat. And places it targets heart valves. So it can cause endocarditis, damage to the heart valves also, so valvular damage. Sometimes you get this strange rash, so erythema, so red marginatum, and so just these margins, and so that's why they called it that. And so you have these little nodules under the skin. Sometimes too, people can have uncontrolled body movements, that's called chorea. But this is just after the infection, so sequelae. It's an autoimmune response where we get cross-reactive antibodies. So once again, this is that collateral damage from the immune system. It was called rheumatic fever, if you heard of rheumatoid arthritis, because that's the #1 symptom, so joint pain. So joint affects the heart. And then also what happens is you get those antigen antibody complexes can also, you have that occurring in the kidney. So that little filtration unit, that capillary in the nephrons of the kidneys is called the glomerulus. So you get glomerulonephritis, so inflammation of those little tiny nephrons in the kidneys. When you have that, you get fever, fluid retention. The big calling card of it is urine that looks like iced tea, because there is hemoglobin, because remember, we also get lysis of red blood cells, and that can be detected on a urine dipstick test. So you get damage to the kidneys from that inflammatory reaction. Once again, it's the collateral damage from the immune system. So there, that is for you. Some strains of Streptococcus pyogenes, if they are causing a wound infection, they make streptococcal pyrogenic exotoxins. So once again, we have that pyrogenic exotoxin, but this time it's going to be in a wound, so as a wound infection. And so this is necrotizing, so it means death, so necrosis. Fasciitis, so fascia, that connective tissue underneath the skin. And so this is a flesh-eating disease. And remember, once again, this is going to be a phage-encoded toxin. So not all strains are going to do this. And so you get a release of those destructive enzymes, so it can spread, and exotoxins, and that strong inflammatory response, we get death of the tissues. And this is rare. It's going to occur in your immunocompromised once again. So think AIDS patients, diabetes patients, cancer patients, alcoholics, you're going to see that. So Streptococcus pyogenes, just like Staphylococcus aureus, different strains can have a whole host of virulence factors, so lots of them. They have those lipoteichoic acids, which helps them adhere, and then also M proteins sticking out on the surface of their cell wall. This drives our immune system crazy, so once again, it tends to cause us to have that cytokine storm, and then we get damage. That M protein also helps them to evade the immune system, so inhibits phagocytosis. It has that high hyaluronic capsule, and if you remember that we have things that are similar, if you remember hyaline cartilage, and so it looks a lot like our tissues, which allows them to sort of mimic host. And this is also that problem with that post-streptococcal sequelae. They also have a G protein which can bind to that constant region of the antibodies so they can avoid opsonization and complement fixation. So they do damage, they drive our immune system crazy, but they can avoid being neutralized. So yeah, so just remind you again, those Fc receptors bind the antibodies the other way. So basically they get protected by the antibodies that are meant to neutralize them and target them for destruction. Oh, they have more. There's more. Toxic proteins, the tissue-degrading enzymes. Once again, we have DNase, high hyaluronidase, proteases. Streptokinase is a special type of cytotoxin, is going to break down blood clots. And then they have streptolysins, which is going to destroy red blood cells and white blood cells. And of course, we already talked about that pyrogenic exotoxin in scarlet fever. Also, Streptococcus pyogenes, remember our good buddy Ignaz Semmelweis, when he studied childbirth or childbed fever or puerperal fever. Yeah, Streptococcus pyogenes also causes that. Streptococcus pneumoniae, so you can kind of guess what it causes, so pneumonia. And I'm going to leave this and put that in your notes. I'd rather do it with some pictures. But once again, this is going to be the leading cause of community-acquired pneumonia. So when you see that abbreviation CAP, that means community-acquired, meaning not in a hospital. It is the leading cause of death due to infectious disease. Often people are co-infected with influenza and pneumonia, but it leads to death. So it's number one for that. Remember, pneumonia is a disease of the lower respiratory tract, so the airways. And the alveoli are going to fill up with fluid, and when they're filled with fluid, there is no gas exchange. So you get difficulty breathing. And then two, in the sputum, you would do a sputum collection from the lungs. And you can see that on an x-ray. So this is pneumonia. So now they call that a ground glass appearance in the lung. So humans are a reservoir. Once again, about 30% of people are going to carry Streptococcus pneumoniae. And once again, we have different strains. Some are more virulent than others. Normally, if someone has a functioning mucociliary escalator, so this is the lining of the airways and the cilia, if they are in your lower airways, they're going to row up the mucus and then you swallow it. But if someone is a smoker, they have lung disease, so this diabetes even affects it, and so if these cilia aren't acting, they have more likelihood of that Streptococcus pneumoniae getting down into their lower airways. And so increased risk for those over the age of 50. And so this is a common cause of pneumonia in the elderly. It can be treated with antibiotics, but there are vaccines for it. So the pneumococcal vaccine, so that's also another name for here, pneumococcal pneumonia, because it's a coccus bacteria, causes pneumonia. That's what they're talking about. And so there's different vaccines available, and most of them are against that the capsule, and so that serves as the antigen. There are now some antibiotic-resistant strains, so the CDC is monitoring that, and that is a serious threat. Their main virulence factor is going to be that capsule. And we talked about how some Streptococcus pneumoniae, they don't make capsule, and some do. And that is going to be due to that phase variation. So it's kind of an on-off thing. Another thing that Streptococcus pneumoniae can cause, they're going to be the #1 cause of bacterial adult meningitis. And so community acquired. And so once again, just to kind of remind you, the symptoms of meningitis, so fever, headache, stiff neck. And so it starts off as an infection that then can spread to the meninges, so the coverings of the brain and the spinal cord. This would be diagnosed through a lumbar tap or a spinal tap. And these strains that do this, they make hemolycins. Then they also make a toxin that induces apoptosis, and then they also have this burst, this release of hydrogen peroxide, which is a reactive oxidative species that causes damage in the nervous system. So number one for community-acquired pneumonia, typically in older people, and then number one cause of bacterial adult meningitis, and also number one cause of death by infectious disease. And so you might be wondering, like, okay, so we have people that are colonized, and that just means their body has a high tolerance, and they are not doing a lot of damage. They can also go from the nasal cavity, so that nasopharynx, to the middle ear and cause middle ear infection, so otis media. We know that they can cause pneumonia, and then if they spread in the bloodstream, then we get sepsis, which can damage organs, and then they can also cause meningitis. And so, yeah, a whole host range of infections can be caused by that Streptococcus pneumoniae, depending upon what strain it is, where it is, and then the collateral damage by the immune system. We mentioned this when we studied biofilms. So remember, biofilms is that polymer that's secreted outside of cells that allows cells to attach and adhere. So plaque on your teeth. So Streptococcus mutans, they make plaque on teeth, and then they take the sugars in the mouth, and they go through fermentation. It is that acid that causes cavities. Name for cavities is dental caries. The other thing that's significant about them that they're now discovering, and this is why there's a link between poor oral hygiene or oral health and cardiac disease or heart disease, is because these are atherosclerotic plaques. You've heard of clogging of the arteries. And so these plaques, they have found that there's bacteria there, and one of the members that's there is going to be Streptococcus mutans. So when you brush your teeth, you introduce those tiny little breaks in the gums, and then the bacteria, the organism gets in the bloodstream. And then they cause inflammation, and the macrophages come. So this plaque is filled with fat, what they call foam cells, macrophages that have tried to take care of that damage to the wall and also bacteria. They're not really sure how that all works together, but now they've identified Streptococcus mutans, and some other oral microbes are growing in and living in these atherosclerotic plaques. So kind of interesting research there. I'm going to stop here. Once again, afraid my computer is going to shut down, so come back for the gram-positive rods.